My name is Sarah Burtnick, and I'm joined today by Martine Monjean, Manager of Episodic Disability Initiatives at the Canadian Working Group on HIV and Rehabilitation, as well as Melissa Popiel, HIV and Episodic Disabilities Coordinator, also at Quigger. Martine today will begin by telling us a little bit about episodic disabilities and how they differ from our traditional understanding of disabilities. She'll also tell us some of the challenges faced by people living with episodic disabilities. Melissa will then give us an idea of episodic disabilities in the workplace and provide some concrete examples about how employers can better support people living with episodic disabilities. And finally, she'll also touch upon how people living with episodic disabilities as employees, what they should consider in terms of employment. And we'll start right now with Martine then. Martine, can you tell us a little bit about episodic disabilities, how you would describe them, and how they differ from perhaps our more traditional understanding of disabilities?
Yes, definitely. So an episodic disability is a long-term condition that is characterized by periods of good health and interrupted by periods of disability and illness. Now these periods differ in length, severity, and in terms of unpredictability from one person to the other. Now some forms of episodic disabilities include multiple sclerosis, lupus, diabetes, some forms of mental illness, and cancer. Now, episodic disabilities are periodic. They have fluctuating periods of illness and wellness, and someone doesn't know when they're going to be ill and for how long they're going to be ill. Now, permanent disabilities are lifelong and relatively consistent, and therefore differ from the episodic disabilities that are more unpredictable and have these fluctuating periods of illness and wellness. And this can have a significant impact on employment participation, income support, access to care and services, and social inclusion. For example, a person with multiple sclerosis may not be able to work for more than 2 or 3 days in a row because of fatigue. And another example is a person living with HIV may have to wait for the side effects of medication to wear off before being able to work, which makes regular office hours challenging. And we know that this is an increasingly important issue that we need to address. Why? Because there are increasing numbers of people living with episodic disabilities in Canada. In fact, 20% of all Canadians will experience an episode of mental illness in their lifetime. 2 million Canadians have diabetes. 65,000 Canadians are living with HIV, and 4 million Canadians are affected with arthritis. So these numbers and these combined numbers are staggering. And it is essential that we address the challenges facing people living with episodic disabilities. Now, the concept of episodic disabilities is an innovative approach to understanding many lifelong conditions that are prevalent in today's society. Now, not all of those living with HIV or mental illness may be experiencing illness-related episodes that move them in and out of the workforce. But these figures really provide an indication of the numbers of Canadians who may be impacted by episodic disability-related challenges.
Thank you for that. Maybe you can provide some more details of the challenges people face living with episodic disabilities, maybe on a daily basis?
Yes, people living with episodic disabilities face several challenges. They face challenges in accessing care, treatment and support. For example, someone living with an episodic disability may lack access to services, and these services, there may be differences between different geographical regions, so and also between urban and rural settings. We find from talking to people living with different episodic disabilities that sometimes they've had to wait 9 months to access services. So accessing services is one challenge. Also, people living with episodic disabilities experience challenges related to medication. And most people need frequent medical appointments, and sometimes at short notice. And they also face challenges in terms of the lack of inflexible workplace policies and guidelines that acknowledge the realities of living with an episodic disabilities. And in fact, if you think about it, due specifically to the episodic nature of their condition, someone can potentially move in and out of the workforce in an unpredictable way. And this can compromise their income security at times when they're not working and earning an income. And in fact, many of these people have to, living with episodic disabilities, need to rely on public and private income support programs and extended health benefits at those times when they are not working. And what we find is that some income support programs do not recognize the episodic nature of many disabilities, and when they do, there are varying policies, programs and practices, because these are designed for different purposes and by different jurisdictions. So it becomes very, very challenging for someone living with an episodic disability to navigate the maze of programs and services. Also, there are challenges in that people living with episodic disabilities may be living with other concurrent conditions. So someone living with HIV may also be living with a mental illness that results from the stress and the stigma and discrimination associated with living with HIV. So these are a few of the challenges facing people living with episodic disabilities, and there are several others. However, this is just a glimpse of some of the main key challenges they're facing.
Well, thanks so much for that great overview of episodic disabilities. We'll now turn to Melissa. Melissa, maybe you can give us a better idea of what exactly employers can do to better help people living with episodic disabilities in the workplace.
Sure. There are a number of things that employers can do to support their staff that are living with episodic disabilities, regardless of whether or not they know the diagnosis that someone may be living with. Now, you can imagine for a moment what it may be like for an employee who is living with an episodic disability and has been off work for a period of time and is now considering going back to work. There are a number of common concerns that this employee may experience, and some of these are concern with potential stigma discrimination. If someone recognizes that this employee is living with an episodic illness, what might they think about that colleague? How might they respond to that person? And in addition to that, if someone has been out of the workforce for a period of time, there may be concerns with whether or not their skills are current, and if that individual can function both physically and emotionally in the work environment at the level that they were at previous to the time that they went off. The last point that I'd like to mention is around disclosure too. Employees may be wondering, should I tell someone about my illness? If I tell them, what might that look like? How will that be received? And what will happen if I do tell? So there's a lot of uncertainties and unknowns when someone's considering going back to work. And there are steps that employers can take, and I'm going to talk about 10 specific points that employers can do to help them allay some of these fears and concerns and make that return to work experience and work integration more comfortable for the employee. First, know that there are many labor force participation options for people living with episodic disabilities. There are sometimes ways that we can consider a particular job description or a type of employment in a different light. Sometimes individuals can work from home, perhaps. They may be interested in flexible work hours to allow them to perhaps wake up, take a certain type of medication that may make them ill for a couple of hours in the morning, and then go to work afterwards. Those types of simple solutions can sometimes be quite effective. There are individuals like occupational therapists that can come in and assess a work situation to determine whether or not there's a suitable form of accommodation that can be used. So those are a couple of suggestions around that. One of the hallmarks of developing policies and programs in the area of episodic disabilities is the need for flexibility. Now, flexibility in terms of those programs and policies is absolutely critical. There's a term that's been coined called flexicurity, and flexicurity is a combined word that means having flexible options in terms of perhaps a variety of different options with respect to accommodation, but also having the security of knowing that there's an infrastructure in place that will allow an individual living with an episodic disability to move in and out of the workforce, or to change their job as need be, and still allow them to be consistent and to maintain that. Another another point for consideration is to factor in what I'm going to call social determinants of health into any comprehensive program that gets developed. And these are factors like access to childcare, or access to stable housing or income support. These are other life factors that someone may be grappling with that may add additional stress to the individual. So it can be appropriate to ask the individual whether or not they have these things in place. Without delving into too much detail, we want to ensure that there's good privacy maintained for that person. But it'll give the individual a prompt to consider these things and whether or not they're ready to be active in their workplace. Next, in any policy, ensure that the episodic nature of illness is included, and that the policy addresses the very unique nature of episodic disabilities. No two people living with an episodic disability are going to experience an illness course that looks exactly the same. And so allowing for that individual element to come through is quite important in these policies. Tip 5 is to increase knowledge and training options for human resources professionals on episodic disabilities and their impact in the workplace. There are a number of different options for human resources professionals to be able to learn more about the topic, and given that they are the primary point of contact for an individual that's first returning to the workplace or that's requesting an accommodation, they really do provide a critical function, and so having that increased training option is really a good way to go. The next tip is to look at varied insurance options that remove disincentives to labor force participation for employees living with episodic disabilities. You can connect with your employer to see if there are other policy options if you find that yours doesn't meet the needs of your employees living with episodic disabilities, or to see if the insurer may be able to adapt a particular policy to better meet your needs. As a consumer, you do have that right to speak with your insurer about that. So there's nothing nothing negative necessarily that can come out of making that call, so it's something that can be done. The next tip is to develop a workplace culture that focuses on the full integration of all staff. I'll speak perhaps a bit about why that workplace culture is so important. We work with our managers from day to day and from time to time, but we spend most of our time really with our coworkers. And so being able to develop an open and comfortable working relationship will really help individuals living with episodic disabilities to continue to perform well. If we're uncomfortable with the people that we're working with, then that's really going to impact on performance. So looking for ways to develop that workplace culture is really a good way to go. The next tip is to develop strong communications protocol between management and HR and other staff and policies and procedures around episodic disabilities. How we talk to each other, when we talk to each other are all critical things to take into account here. And looking for ways to keep that dialogue going so that if someone does start to experience an illness episode, that early intervention can occur will help reduce the likelihood that someone may be off due to illness, and will also help the individual to continue to function well and to feel supported, both of which are really key to continuing in employment in the long term. Next, and this is tip number 9, having regular check-ins with a medical professional also helps to keep someone well. And knowing that someone living with an episodic disability is going to have regular check-ins with their manager can help with workplace health, so that having those regular check-ins really does benefit someone. Lastly, with the employee, do show understanding for the person and their need to have good health care and employment supports in place. Again, look for different ways to open those channels of communication and explore a variety of different types of accommodation options with that individual. For suggestions on what those accommodation options may be, talk with your human resources professional or look to their website, look to the provincial website that trains human resources professionals for more information. And lastly, do take a long-term view of accommodation planning. Because episodic illnesses are, in most cases, lifelong, the need for ongoing dialogue and perhaps even accommodations may be over the course of someone's working career with you. So considering this and planning for it in the long term may mean a bit more time invested up front, but it can yield some very productive and healthy results in the long term if that's taken into account. So these are just a couple of tips that can get you started.
Well, great. Thanks very much for that really practical information for employers. But Melissa, can you also give us an idea of what employees living with episodic disabilities should consider to work effectively with their employers, but also with their broader group of colleagues at work?
Sure, happy to. Employees should know the following. One, they should give some consideration to what their plan is to maintain good health. The employee should be working closely with their medical team, and sometimes it does take a while to get that team in place. But once that is there should be a good plan of care developed. And the employee can inform you about what their participation limitations may be in the workplace, and then you build accommodations around that. The employee should also know how accommodations are to be requested. So if they have a need, who do they talk to? What can they do to be able to request an accommodation? Does the employee know what options may be available to them in terms of accommodations? This is general education that can be done with all staff, and it's quite empowering when staff know what that process is. Then they feel that they're comfortable and supported if a need arises. Next, who the point person is that they'll contact on a regular basis. So if an employee is speaking to a manager or a particular point person, they should know who that person is, the frequency with which those visits may happen, and approximately the length of time. They don't necessarily need to be long check-ins, but just periodic, depending on the way that someone's illness course may run. Next, employees should be fairly familiar with your organizational policies on disability, sick leave, and employment supports. When the employee knows where those policy boundaries are, it helps them to know what they can expect and what you're able to offer them as an employer. Next tip is to train employees on what their employee assistance program offers. If you are an organization that does offer an employee assistance program, there are options to bring in a representative from the program, or perhaps some literature that talks about some of the basic features of that program, and that can be fabulous in terms of education. Employees really do benefit from these types of suggestions. They let the employee know that they're supported in the workplace, that their employer has a plan to be able to help them, and that whatever does happen in terms of their illness, that they're going to receive the supports and assistance that they need. This can reduce someone's stress level, which may in turn even reduce the likelihood of an illness episode. Next, employees should also know, if they're returning to the workplace, what personal and or health issues that they may experience that might be potential barriers or restrictions in the workplace. So looking at those is important. And just in closing, a couple of other suggestions. The employee should know what they plan to do and to help them maintain a healthy work-life balance. And on an ongoing basis, how he or she will access the health care that they need. So hopefully those are a few things that can be recommended to employees that will help them throughout the course of their employment.
Great. Well, thanks very much for that. And maybe as a final question, from a broader or maybe a more long-term perspective, what can employees do to create a really inclusive workplace culture that is diverse and respectful of people living with episodic disabilities?
Sure. Creating an inclusive workplace culture involves creating both processes and an environment that will foster open communication and make the workplace a place where staff want to be and that they actively contribute to build a more inclusive organization. Know that creating a workplace culture that's inclusive of people living with episodic disabilities is an ongoing process, but it can be initiated at any time and should be something that starts from the top down and involves all management and staff. And there's a couple of suggestions to develop an inclusive workplace culture. So with coworkers and all staff generally, do discuss those accommodation practices. Let coworkers know what your policies are and what accommodation options are available to them. this is something that can be done right from the time that someone's hired, and can be reminded different points, perhaps 6-month intervals or 1-year intervals, whatever you feel is relevant. But do discuss your accommodation policies. Next, educate staff about the impact of episodic disabilities in the workplace. And also let them know that if there is an employee with an episodic disability, that you have a plan in place to support that person and to ensure that other staff aren't going to be asked to undergo unreasonable demands. Sometimes other staff are worried, am I going to be asked to pick up the entire workload of my colleague? So think through that process of how that work might be distributed, or what's going to be done to ensure that those job requirements are met without becoming too burdensome on any one individual. Do encourage staff to support their colleagues living with episodic disabilities. And oftentimes other staff won't know what the type of disability is that someone's dealing with, and we need to respect privacy appropriately. But friends or colleagues can ask, how are you doing? Is there something that I can do for you generally? And just being a friend to the individual can go a long way. Encourage them to express genuine interest and concern for the welfare of that person. When we talk about someone living with an episodic disability, this illness is a part of someone's life, but it's not the whole sum total of their life. And so continuing to ask questions about other aspects of someone's life and not just focusing on the illness can help build a relationship of trust and break down some of the barriers that may come up if we focus too much just on the illness itself. So do make all employees aware of support options, both inside of your workplace, like some of the ones I just described, and some of the external options that may exist. There are some organizations that have developed wonderful intra-organizational programs. Some of these are lunch and learns, they may be coffee groups that get set up that allow for internal discussion and support amongst different co-workers. The Employee Assistance Program is always an important program to understand. But external to the workplace, there are a couple of options as well. One of these are peer associations, and these are sometimes networks, sometimes official organizations that are developed that are for people living with a particular type of episodic disability, and they're run by people living with that type of episodic disability. And so they're very, very familiar with the illness course and what someone can expect when they're in the workplace, and can provide some great tips and other emotional supports for someone going through a particular challenge. And there are also disability organizations like the National Network for Mental Health or the Arthritis Society, and quite a number of others for specific types of episodic disabilities. And these disability associations provide information. Sometimes they provide more temporal supports for people living with episodic disabilities that can give them additional assistance in areas where they may need that. For the organization themselves, if you are looking for more information on a particular topic, like mental health, then these organizations can be contacted. They often have brochures and flyers, information that they can use to train you on that particular type of episodic illness. So that's a couple of suggestions there. So hopefully these suggestions will help you begin that process of improving your workplace culture. And do remember that this really is a process, and there likely will be challenges along the way. But if you're, as an organization, willing to take some risks and to try some of these suggestions, you'll find things that will work for your organization specifically. And you will find perhaps some things that might not. But we learn from these sometimes this trial and error process, and we move forward. Going through this and letting staff know that you really are willing to work with them will help with that integration. It will build trust, and it will, in the long term, help you to have staff that are committed to your organization because they know that you're willing to work with them. If there are other ways that we can assist you, then we're more than happy to do that as well.
Well, thanks so much, Melissa. The information you provided is really concrete and practical, and I think it will really go a long way in helping employers to better assist people living with episodic disabilities. Thank you also, Martine, for joining us today. You gave us a really great overview of exactly what episodic disabilities are and why they're unique and how they affect people's daily lives. If you would like more information, feel free to contact Melissa or Martine at the Canadian Working Group on HIV and Rehabilitation. Give us a call at 416-513-0440, and also feel free to visit the website at www.hivandrehab.ca, where there's lots of practical resources and more information. And thanks again for joining us today.